Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. In today's session, we are going to learn about a new as well as a very informative topic, that is the categories of the nursing personnel. In today's session, we are going to learn about what are the various categories of a nursing personnel as well as their roles and responsibilities. So as we all know that nursing service is a part of the total health organization which aims at satisfying the needs of the patient as well as of the community. Here in nursing services, the nurse needs to work with the members of the allied disciples such as the dietetics, the medical social service as well as the pharmacy in order to supply a comprehensive program of patient care in the hospital setting. As we all know that nursing service is a part of the total health organization that aims to satisfy the needs of the patient and as well as of the community. Here in nursing services, the nurses are required to work with the members of the allied disciples such as the dietetics, the medical social service as well as the pharmacy in order to supply a comprehensive program of patient needs in the hospital. So now let's move on to the definition of nursing services. Here, according to WHO, health services is defined as a part of the total health organization whose main aim is to satisfy the needs of the patient as well as of the community. The major objective of these nursing services is to promote health as well as to prevent diseases. So here, as a nurse, you will be responsible for providing the nursing services to the patient as well as to the family members and the community. Here, you will be educating them about the various importance of these nursing services, and you will also be helping them to promote their health as well as to prevent the occurrence of the diseases. Now moving on to the organization of nursing services in hospitals. Here in hospital settings, we have the chief nursing officer, the assistant superintendent, the deputy superintendent, the assistant nursing superintendent, and we also have the ward sister clinical supervisor. Then we also have the staff nurse as well as the student nurse. So now let's look at the roles and responsibilities of each one of them. The first one here is the chief nursing officer. So as a chief nursing officer, he or she will be responsible for the efficient running of the healthcare services at the hospital settings. She or he will also be responsible to she or he will be responsible for efficient running of the nursing services in the hospital. She or he will also assist the director in formulating the policies of the nursing services and will also be the one to inform about anything concerning to the hospital settings. She or he will also be the one who will be responsible to inform about the aim, objective, as well as the policies of patient care to all the people who are responsible for providing these nursing services, and as well as they will be responsible for implementing these policies as well as the procedures of institute regarding the nursing services. She or he will also be responsible for planning the future requirements of the nurses as well as conducting the recruitment process for the nurses from time to time. She or he will also be the one to plan as well as disseminate programs for continuing education reorientation program for the nurses in the hospital settings. She or he will also try to encourage the other nurses to conduct researches in their work area. She will also try to implement the standard nursing practices as well as maintain the highest quality of care which will be provided to the patient. She will also be responsible for analyzing the budget in order to conduct the nursing services, as well as she will be the one who will be evaluating the confidential report of the highest level nursing officer as well as recommend for their promotion. So these are the roles and responsibilities of a chief nursing officer. Now moving on to the next, that is the nursing superintendent. So now we will look about what are the various roles and responsibilities that she needs to perform in the hospital. The first one here is that She will be responsible for planning, organization, as well as development of nursing services in the hospital in consultation with the medical superintendent or the chief of the centers. So here, being a nursing superintendent, you also have to planning, organization, and development of nursing services in the hospital in consultation with the medical superintendent or the chief of the centers. You are also responsible for implementing the hospital policies among the various unit which is present inside the hospital. She will also be the one to make recommendation as well as material requirement for various nursing services department of the hospital. She will also ensure that each patient which is present in every unit will be getting a safe as well as an efficient care. She will be the one who will be preparing a budget for the nursing services, and she will also be the one who will be preparing a duty roster for the other nursing staff. Not only that, but being a nursing superintendent, it is also her responsibility to counsel and guide the other subordinate staff. So these are the various roles and responsibilities of a nursing superintendent. Now, moving on to the deputy nursing superintendent. Being a deputy nursing superintendent, it is her responsibility to coordinate or to assist the nursing superintendent for the administration of the nursing services in the hospital. She will also be supervising the various nursing care which is given to the patient in various departments by conducting rounds regularly. She will also act as a liaison officer between the nursing superintendent as well as the staff nurse. She will also be the one who will be interpreting the policies and procedures of the nursing service department to the other subordinate staffs of the hospital. She will also be the one who will be maintaining a record of the attendance of the other nursing personnel as well as if they have taken leave of any kind. She will be the one who will be conducting a regular physical verification of the hospital drugs or any other equipments which is present. She will also be the one who will be initiating the procedure for condemnation and procurement of the hospital equipments or of the linens. She will also be the one who will be maintaining a confidential record and report of the other nursing personnel. She is also the one who will be responsible for maintaining a discipline between the nursing personnel. She will also be the one who will be arranging an orientation program for the new nursing staff. Now, moving on to the next, that is the assistant nursing superintendent. As an assistant nursing superintendent, it is her responsibility to assess the total care which is being given to a particular patient. It is also her responsibility of management as well as development of the particular unit which is being assigned to her. She must be the one to plan as well as arrange duty for the nursing personnel who are posted under her. She must also be the one to ensure that there are adequate nursing staff who will be available in every shift. She's also the one who needs to maintain the cleanliness of the unit as well as the environment. She's also the one who will be interacting with the engineering service department in order to keep the unit proper. She will also be the one who will be maintaining a discipline between the other nursing staff, and she's also the one who will be maintaining a good relationship with all of the healthcare professionals. So these are the various roles and responsibility of an assistant nursing superintendent. Now moving on to the next, that is the nursing sister grade 1. Here, it is the responsibility of them to provide a total care to the patient. It is also their responsibility to supervise the nursing sister grade 2, the student nurse, as well as the domestic staff. These nursing sisters grade 1 will be assisted by the other nursing sisters grade 2, the clinical as well as the domestic staff. Here, the main focus of these nursing sisters is to foster the team spirit in her area of work as a team leader. So these nursing sisters, grade 1, are the ones who will be providing the total care to the patient, but they will not be doing this alone. They will be assisted by the other staffs or by the student nurse or the domestic staff in order to provide care to these patients. The main aim of doing this is to help the others also learn from them and to help others also clarify their doubts if they have any. The last one here is the nursing sister grade 2. Here, as I've said earlier, that these nursing sisters grade 2 are the ones who will be assisting the nursing sisters grade 1 in providing care to the patient. Here, these are the ones who will be learning many new things from their senior nurse as well as develop their skills. So now, this is all about the organization of the health services in the hospital. Now, moving on to the next, which is the organization of the nursing personnel in the educational institute. Here in the educational institute, we first have the principal, then comes the vice principal, then the associate professors, assistant professors, the clinical instructor, as well as the nursing tutor. So these are the various nursing personnel who will be present in the educational institution in order to educate the future nurses for the development of skills and for also providing theoretical knowledge. Now, moving on to the organization of nursing personnel in the community setting. The nurses working in the community level is also a large part of the healthcare delivery system. Here, these nurses will be working at various levels in the community settings in order to provide care to the people. They can be broadly classified as the female health worker or the community health nurse. Here, the female health workers are the ones who will be providing care for the prenatal as well as the postnatal mother. They will also register as well as keep a track on the newlywed couple. They will also be providing education to the mothers as well as to the other family about the importance of immunization as well as nutrition. They will also carry out the family planning services as well as include the distribution of contraceptive in order to promote the small family norms. They will also be the one who will be providing treatment for the minor ailments as well as notify if there is presence of any communicable disease in that particular community. They will also participate in various disease control programs in order to educate the people about the important measures that they can adopt to prevent themselves from falling ill. They can also conduct survey as well as maintain records and registers of all the services which is being provided to the people as well as vital events like birth and death. So these are the few roles and responsibilities of the female health workers. So moving on to the next, that is the community health nursing. In order to become a community health nurse, you must have a general training as well as a basic education on community health nursing. You must also have a degree of BSc nursing. So now let's look on what are the roles and responsibilities of a community health nurse. Here, as a community health nurse, it is your responsibility to provide health education, to be an individual practitioner, decision maker, advocate, researcher. So, as a community health nurse, it is your responsibility to educate the people on the various factors that they can adopt in order to promote their health. You must also be the one who will be making decisions for the benefits of the people. You can also act as an advocate, as a researcher, as well as a direct care provider. There are various community health nurses in various states in India. They can be classified as DPHNO, that is the District Public Health Nursing Officer, the BPHN, that is the Block Public Health Nurses, then the PHN, that is the Public Health Nurses, as well as the ANM, that is the Auxiliary Nurse Midwifery. So here we have come to the end of this topic, whereby in today's session we have discussed about the organization of the nursing personnel in the hospitals, in the educational institution, as well as in the community settings. We've also discussed about the roles and responsibilities of each and every personnel who are involved in each and every settings. So I hope you guys have got a clear insight of this topic. Thank you.